Hello, class and professor. I am going to compare the differences between bioethics and public health ethics. Bioethics is synonymous with ethics related to all living or health related things, as it is closely aligned more narrowly with medical ethics. And public health ethics are applied to interactions between agencies and the population it serves. Interdependence, which is one of the key principles, is a common concern for people, and the tensions are between their rights and the community for good. I will compare bioethics and public health ethics to air quality. If bioethics is to be a serious health advocate for justice, there must be an advantage to take the lessons of the COVID-19 pandemic that was given the relationships between racism, environmental toxins, and health equity. And that will make environmental justice to be the cornerstone for research and the teachings of health justice. Air quality, such as pollution, is a major environmental health problem that affects everyone globally. As policies continue to reduce air pollution, it is the second highest risk factor of a non-communicable disease, which is the key to protecting public health. For example, successful policies can reduce air pollution for industries, energy, transporting, urban planning, power generation, municipal and agricultural waste management, and activities related to healthcare. Regarding the bioethics symposium, is obesity considered to be an epidemic? Yes, it is, because it is a disease which was defined by the American Medical Association. One example defined as a public health issue, obesity is nothing less than a health crisis, but it is a chronic condition that can lead to health problems. How bioethics and public health ethics are associated with vaccine mandates is that it has been a process of preparing for disease outbreaks and pandemics. To compare vaccine mandates of ethics in COVID-19, this issue has been a complicating part of the pandemic to make decisions on removing the burden of emergency restrictions. The issue is a most restrictive form of vaccine policy in terms of personal autonomy. There has been a lasting protection against infectious diseases just like the COVID-19, which can provide a public good, and it allows the chance to reduce outbreaks and disease transmissions. Beginning of the pandemic, the evidence of mandating COVID-19 vaccines was to prevent disease transmission. The intention of COVID-19 vaccine that was mandated by public health has become less relevant as the herd immunity against the virus was impossible due to the uneven vaccine, and infections started to be dramatic.